for all of our presenters, thank you for taking the time out to do this as well. If you haven't been following, FPMA does have a seminar specifically geared toward young practitioners. Young practitioners are defined of anyone 10 years out from your medical school graduation. So it really does encompass our tail end of being a student onward through residency, as well as all the way through first couple of years in practice. So at the end, I'll kind of highlight some of the upcoming lectures that we'll be covering through FPMA. Definitely a valuable resource. So share along if any friends aren't logged in, certainly hit them up and tell them to do so, listening in the background as they're studying. As you can see, we have an excellent panel tonight. The idea of this is more or less to give you some inside info as far as what to look forward to, as far as the steps into residency, as well as when you're in residency, what you're supposed to be doing as far as getting certain credits under your board if you are looking forward to Florida licensure. I know back in the day, for me, I kind of pretty much relied upon either the class ahead of me or the residency class ahead of me, just kind of shuffling me around, telling me what I should and shouldn't do. So this should hopefully glean some insight as far as the years ahead. I'll just generally breeze over our panel before giving them an opportunity to speak. First and foremost, we have Dr. Hannah Istre. She's a second-year resident at Advent Health, East Orlando, located in Central Florida. She's a rock star. I've worked with her in and out of the OR. Really, really a great person to connect with, and I think she'll have some great insight for you. Additionally, we have Dr. Julio Ortiz. He is currently the residency director at Bethesda, located in Southeast Florida. And I think having the perspective of a residency director is really special. For you guys logging in, these are kind of the opportunities I would have died for as a student to kind of get inside the brain of someone who not only is a leader, but also, a respected surgeon, and someone who's kind of been through the ropes as far as this process of residency and certainly seen the development of the program and the practice of foot and ankle surgery. So I'm very, very grateful for his time and willingness to give us some gleaming insight. Additionally, we have Mr. Jason Wynn, who is our general counsel for FPMA. He's going to help highlight what we all cringe over, the law, as far as the rules, the regs, what you all need to look forward to as far as your first year of residency. There are really important particular requirements that you must hit for you to obtain licensure as well as keep it within the state of Florida. Again, I didn't know till I knew, and thank God certain deadlines I hit. But it's kind of like being at a small school. If you miss like that one chemistry class, you're kind of in trouble. So I'll tell you that the timing of this all is very important and appropriate. Okay. I also am very, very honored for you all to probably see in the background Miss Karen Lambert, who's our CEO of FPMA, and she's in control of our slide deck for the evening. So Karen, if you don't mind forwarding our lecture topic. So here we are. This is what we are to discuss, unlocking your potential in residency. Again, plenty of time for people to join in. So if friends are just kind of watching TV, tell them to watch this instead. So shoot them a text with a link to the Zoom. We really, truly are collegial, we're fraternal within this organization. I can't speak highly enough, not only just running up the ranks through FPMA, currently serving as your president, but just how powerful a state as well as a national association is being in a small profession. There's a lot that goes on behind the scenes. This is just not an old guard. There really is a lot going on politically. So keep your finger pressed to your news you can use and articles along the like to see what FPMA is up to. Karen, if you can go to the next slide, please. Also, fun fact, for those of you participating, there is a $50 gift card at stake that will be randomly chosen for those individuals that are sitting through this listening to us tonight. So stay tuned to the end. Very good. Next slide, please. This is kind of what we're covering. As if I didn't hit it already, these are our learning objectives. Keys and skills to succeed as a resident, really how to stand out as far as externships as well as interviews. How terrifying is that? That's right around the corner. We're here to give you some inside info and really calm your nerves to help you present your best self. I think that that's some good advice. We're also going to be covering the legal and licensing essentials to practice within our state. And finally, I'll round out the evening with our resources through our association to kind of help you along your professional journey. We may have time at the end for questions. At that point in time, we just ask that you raise that little yellow hand and we'll kind of tackle things as they come about. All right, so kicking this off, I'm going to introduce Dr. Hannah Istri to start us off on this intimate discussion. Basically, like we said, we are where we came from, and we're going where you guys take us in a sense. So it's been a while since I have certainly been in residency. So Hannah, if you don't mind kicking this off, I want to start out with the basics, more or less. How do you choose an externship?
So I went to Temple. A lot of choosing externships for us at our school was by word of mouth. You always hear about this historically good programs, whether it be um, University of Pennsylvania or Advent Health East Orlando or JPS or something of that sort. So that's kind of where I started out. I started out by talking to the people in the class above me, and I got like a good basis of externships that I thought would be really good experiences and great places to learn at. I also looked at the list of externships that they have online, and I kind of also chose regions that I thought I'd want to live in. That was also important to me. And once I kind of narrowed down regions I wanted to live in, I reached out to the programs themselves and just asked general questions like, what are your caseloads like? What do you focus on? Are you more of a recon program? Do you get more trauma? How many residents do you, well, you can find out how many residents you have a year, but it's something I put into like an Excel spreadsheet. And I just made a list of everything. And I kind of just chose one, a little bit based off of word of mouth, but two, after putting everything into the spreadsheet, I looked at the programs that aligned with where I want it to go and goals that I wanted to get out of residency to help me in my future career.
Yeah, those are really great points for sure. If you haven't, if you're talking to students right now who haven't been on an externship, like what do you bring with you? Like, how do you academically prepare for an externship?
So academically, my big thing was Prism. It was written by one of my favorite professors, Dr. Andy Meyer. And not only because I love him, it's just a great resource. It has every quick bell ringer question someone would ask you. Like if you're in a case for like a calc fracture, that Prism book has every classification listed. It has different like surgical approaches listed for it. I thought that was a really good resource. I also use Glamries pretty frequently to prepare for externships, just in case I got asked like, oh, what structure are we going to encounter before you even make the incision? As a student, you kind of freeze up a little bit, just being put on the spot like that, being asked a question and trying to make a good impression. So I always like to read the McGlamry's chapter on whatever procedure I would be doing or participating in before getting there, just so I was familiar with everything that we could encounter, or like different types of fixation. Sometimes I got asked that question, like, oh, well, would you put like one or two screws here or something like that? So McGlamry's really helped with that. And another thing I discovered is I can't remember the name of it, but the limb salvage surgeon on Instagram runs this like podiatry website that you can subscribe to. It used to be $50 a month. It might be more than that, but they actually video surgeries and they talk them through and they show you the exact structures and how to cut. I thought that was super, super helpful for externships and preparing and watching those videos before seeing those procedures, because you kind of already knew what to expect and you saw it not only in a drawing, but like on an actual cadaver or human person, whoever they were dissecting it on. So I thought those were super helpful things to prepare for in externships.
Yeah,
And then
that's
still what? Oh, sorry.
no, yeah, 100%. I was going to say it's almost information at your fingertips at this point in time. So to your point, it's like, what source do you go with? I mean, is
Yeah.
YouTube valid? Like, what are the indications for this procedure? So I think starting with the fundamentals is really huge. Um, Jumping in further, the leap from externships to residency. I mean, I think that our externs really do prepare very well. I think that a couple of them try to get a few practice ones under their belt per se. The system has certainly changed to where you have a lot more externships, which I think is a wonderful opportunity to get a lot of variety throughout the country. And in doing so, you get some of the nerves out early on. But when you talk about preparing for residency, I mean, it's really a camaraderie amongst your peers. With that being said, what rotations as a resident did you feel have been like the most impactful for you, as a closing out your second year of residency?
So I can definitely say that there's two rotations that stand out to me. Our first one is vascular surgery. Um, Being a podiatrist, you don't only do like the cool elective and trauma cases, you do get a lot of diabetic foot infections. And with that comes people who have pretty severe peripheral vascular disease. Our vascular surgeons at our Orlando campus are absolutely incredible. They love to teach. I've scrubbed numerous cases, seen so many angiograms, sat down and looked over imaging with us. They've taken us out to academics, and it really helps you just understand exactly what's going on, like the physiology of the blood flow and everything going on in the foot, which you can translate to how you want to treat a patient. Like someone may have a gangrenous toe, and you may think, oh, let's just take off the toe, but you have to look at the imaging studies and you have to see at what level can they heal. And they've kind of drilled that into our heads and let us scrub with them a ton. I've performed countless below the knee amputations, got to see that anatomy while doing it. So that
Mm.
really stuck out to me. And they are always a text away. When I was an intern, we kind of dealt with the floors more so than as a second year. But I was texting a vascular surgeon probably 3 or 4 times a week just to get their insight on our patients or to set them up for an angiogram, or something of that sort, or even to get them transferred for a bypass. You never know. You never really know.
Yeah, I mean, how do you compact externship and residency in 15 minutes? It's pretty tough, but you did a great job as president. Sorry. So like closing out on your little segment before we get to the Q&A at the end, I mean, any tips, tricks, pearls, like you are still working with externs and you're being squashed between attendings and then talking to other providers. So, what would be kind of some words of wisdom that you can give some students?
Work on your time management skills. Start now. It's absolutely imperative. You want to be able to find time to do something for yourself, like even if it's 15 minutes a day, especially as an intern.
Mm.
Um, Having that little bit of time to yourself is huge. But like Dr. Schmidt said, you're going to be squished between your attendings pulling you in one direction, and then your patients want to talk to you while you're on the floor. And then you're supposed to be teaching an extern how to do something. And then an ED consult comes in, but then you're supposed to be at this surgery. It's incredibly difficult. You have to learn how to manage your skills,
Yeah.
what things are a priority, what tasks need to be taken care of first. And you also need to learn how to rely on your team. Don't underestimate your co-residents that you're going to have one day. They can be a big player in your success for residency, even if it's something as little as responding to a message that someone sends you on Epic that you haven't had the chance to get to yet. It makes a big difference, and it kind of takes a factor off of your plate. So time management is definitely one thing I would focus on the most, because in residency, it's all about that hands-on experience. You can be as prepared as you want to as a student, but it's not the same until you actually get there. But time management is something you can definitely work on starting now.
That's a great point. I mean, a lot of people say like, gosh, like how do you do this in practice? Like, how are you doing cases and this? And you're a mom. I was like, oh no, residency, it treated me just fine. I could do anything after that. So I think that's a really good point. Time management. You guys are all here. Like you're in medical school. Like you've probably checked a lot of boxes academically, but that load in college even can be quite overwhelming. So great points, Hannah. I appreciate you. And we're gonna switch over to our next slide. And Hannah, if you can hang on in case there's any other questions as far as you being in the residency that we might need to circle back to. So next, I'd like to introduce Dr. Julio Ortiz. He's coming up with us from Southeast Florida. And, real simple question for you, sir, starting out, like, especially pre-interview season, what do you look for in a resident? And I'm not sure. I'm so sorry. It might be on mute still.
There we go.
Perfect.
I'm still not technically technologically savvy. Um, after probably 3 years of Zoom meetings.
Yeah.
Um, but yeah, there, I tell you that that's not always the easiest answer. Generally, we we can give the typical answers. We're looking for someone who's academically sound, easy to mold. But I think for our program and probably a lot of programs, it's multifactorial. Generally when we're looking at for residents, we want to have someone who's going to be hardworking, who's going to come in and want to learn and want to take the time to take that extra effort outside of the hospital and outside of the operating room. And that's something that generally comes with the student. We often will try to select students from our bank of students that have spent their clerkship month with us. I always tell everyone it's kind of like a 1 month long clerk,
Yeah.
interview.
Yeah.
You really get to know the residents. If generally the more residents you have, the more personalities you need to try to match up. And I usually, when we match up our first year residents together, the first thing I tell them, I sit them down. We have like a 1 hour long interview, kind of on their first week, and well, not really an interview, an hour long meeting, and I kind of tell them, I said, listen, you guys are going to be like a married couple for the next 3 years. You're going to speak to each other more often than you sometimes will speak to your spouse. The hours are long, the days will feel like they're never ending, but these are 3 years of residency and you never get this time back. Probably some of what Hannah was talking about, as busy on my busiest week, I'm never going to do as much surgery as my residents do in a week, and so we're looking for someone who's going to kind of come into this willing to work with an open mind and open to be moldable. If someone's coming in already with thinking they know everything, then that's not really who we want, because they're not going to absorb. We're generally looking for someone who's going to be a sponge, who's going to come in, absorb what we're providing as far as our education and from all the attendings, um, but also take that and kind of grow from it. I don't want someone who's only going to take direction. I want them to kind of take some initiative. So there's a lot that we look at during our residency interviews. We often look for, we provide cases, and we're looking to see that, um, if a resident is called to the emergency room, are they going to make the appropriate decisions? Are they going to do something that may make themselves, the hospital, or their attending liable? Um, so there's a lot we look at.
Yeah.
But
It's a very
generally,
hard question.
yeah, it has a lot. It's a combination of academics, personality, and willingness to learn.
So I could see it from, going back to the heyday as being a student, feeling just like you're yourself. I mean, between standing out or nerves, I mean, any tips, tricks you have kind of going into interview season? I mean, what's that like being on the receiving end as well as the opposite end of the table? What would you tell your kid if they're going in front of a residency panel to try to kind of win or impress somebody on that spot?
I generally tell the students, and they sometimes every student that rotates through our program spends a week with me in the office. So I get a little bit of one-on-one time with them, and sometimes we'll sit and chat. And a lot of times I tell them, just be yourself. When you're there in the interview, if you're pretending to be someone other than you are, it's going to show. Just be yourself. Answer the questions as calmly as you can. Sometimes you may not get the right answer, but have the willingness to say, you know what, I don't know that at the moment. I'll have to get back to you. Or if you don't know the answer, don't try to make it up, because sometimes you just kind of dig yourself a hole when you're sitting in that interview and they ask you a question and you're just kind of you throw out a random answer that is not right, but you end up just kind of making yourself look worse. So a lot of times I just tell them, be yourself, be relaxed, let your personality shine through. The other thing I always tell the students is rank, when it comes time to rank the residency programs, rank the program that you want.
Mm,
Sometimes they'll get in that situation where a program after interviews will call them and say, listen, we really want you to be our number one pick. What do you feel about, how do you feel about us? And they're not really supposed to do that, but some programs will do that. And there's students that because their number one residency hasn't really reached out, they get nervous and they may rank their second or third preference because they feel like they're going to lose out. In the residency match process, it goes to the student first. So rank that program that you really want first, and there's better possibility you're going to get that program versus ranking a program that you may not. It may have not been one of your top preferences, but they committed to give you their first spot, and you feel guilty, and you
mm,
select that program, and sometimes you end up matching with a program and lose out on a spot that you really wanted. And the third thing I'll say is, often around the residency match process and the interviews, the students will start to gossip a little bit. And, I remember years ago, a student sat during the interview with us and said, I don't know why you guys are doing this. Everyone knows that you already know who you want. Um, and it wasn't the case. There was a student that went around and told everyone that she had the program to try to scare the other students away. And unfortunately, it kind of led to a situation where some students didn't think they even needed to interview. So,
mm.
what I would say is just kind of don't listen to the gossip around the residency program interview process. Feel comfortable, be yourself, and what reaching out to the student or to the residents of the program and reaching out to the directors after the interview process. Sometimes just a little note saying thank you for the interview kind of goes a long way and keeps them or keeps you in their kind of um, in their sight.
Yeah, that's absolutely true. And I'm sure you've seen the maturation of quite a few surgeons throughout your day, and
Hmm.
seeing, the eager, engaged, but book smart individual versus the prophetic surgeon, leaving your program. What are some things within your program, or it not to be program specific, but I mean, how do you think people gain kind of confidence in this role? A lot of people are a little timid as far as their potential skills or like their communication with, I mean, like Hannah said, I'm talking to patients and suing their needs. I'm communicating with their attendings. Like, is it just kind of more or less experience? Is it modeling their senior, residents? What have you noticed?
Um, I think a lot of it comes to time spent. I think with experience comes confidence and comes proficiency. Um, and so generally, spending time with the mentors that you find practice in the way that you'd like to practice in the future. Sometimes you may have an attending that doesn't do the things that you want to do the way you want to do it. But there's also you learn as much from the ones that do it the wrong way than just as much as you do from the ones that do the right thing. But ultimately, finding an attending that will serve as your mentor. Obviously, spending a lot of time with your directors and communicating. I think a lot of the 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 biggest benefits from residency come through communication and time spent. Surgeon who's only done one bunion surgery is not going to be as competent as the one that's done 1,000, right? And so, I think spending the time, taking the opportunities, and recognizing that it's only 3 years, and
Mm,
in that 3 years, you want to put as much experience in the bank, in the memory bank, so that when you graduate, you're proficient, and it becomes almost like second nature.
yeah.
One of the things that I always ask my residents to do is before and after the surgical procedures is to send me what we call a write up. So generally, prior to surgery, I'll have them write up, just ultimately just basic specifics on the procedure we're doing, the anatomical landmarks that we have to avoid, possible incision planning, fixation techniques that we could utilize, and then afterwards sending a more detailed write-up on specifically what we did. And those write-ups, get progressively better throughout, through their 3 years. In the first year, it's ultimately just a skeleton. I tell them by the end of the third year, it's a nice meaty meaty corpse. And so, they go adding into it, picture, they draw pictures, they add what kind of retractors we used, and so really ultimately it's just cumulative. It's adding little things to the experience, and little by little you start kind of beefing everything up. And so again, for me, residency training is just experience, time spent. The more time you spend, the better you are. And we give our residents time off, obviously to for their mental health, and to decompress. But sometimes, it's some of them don't even want to take it because they know that if they miss a day, they may miss a case that they may never see again.
Mm.
So a lot of it is, it's a very short period of time. It's 3 years. 3 years go by very quickly. I still remember being a resident, and it's just, I was just thinking about it today. I'm like 17 years out. Um, it just goes by quicker than you expect.
It's really
Um,
true.
but it is a short time. It's in my mind, it's a very short time to acquire so much knowledge. So the more time they spend, the more proficient they'll be.
Thank you. And what sort of, I guess, supplements do you feel like is valuable as far as residency? Because Lord knows it's just a lot of cases, a lot of prep for that. But do you feel like journal
Yeah.
articles are pulsed out? Do you feel like more or less, review of cases in a grand academic scheme, research? Like, what do you feel like residencies kind of take a pause on that's beneficial?
I mean, I think there's so many things that kind of add to the entire overall experience, but I think generally, um, you know, there's a lot of great books that have a lot of kind of compiled knowledge. I think journal articles are great. We review journal articles 3 days a week or 3 days out of the month, and we have the residents do lectures, and sometimes just putting the lecture together is great because it during that period of time, I tell them, by the time they present the lecture, they need to feel like they're the expert on that topic. So you kind of put everything together. We do grand rounds once or twice a month, and those are great because you actually get to present a case and then kind of pick it apart and talk about what was done right, what could have been done better, and sometimes just the debate and the discussion you learn so much more from. Um, but there's so many things that we can use. I think I always tell the residents to kind of think critically. When we're reviewing these journal articles, some are great, and then some, you can kind of pick them apart, and so we always try to look at things critically, and try to figure out what could be done better, and uh, where we could be better as a program.
Thank you very much. It's cool.
Yeah.
With respect to time, and I'm sure there's tons of, or hopefully questions for Dr. Ortiz as well as Dr. Hannah. I'd like to move this segment along to Mr. Wynn. Just like you guys described, there's so much going on. It's just this like food fest of information, of curiosity, of learning, of history, of technology, how things are changing year after year, how our vendors, even at SAM, walking around the exhibit hall, I mean, stuff that you were trained on may not exist in the future. So you really do have to push yourself as a physician to be a lifelong learner. Meanwhile, there's stuff going on in the background. That's pretty much the rules, the regs, things you absolutely need to be aware of. And like I said, if you don't have, a finger on the pulse, you might be missing these opportunities that might cost you time or money later on. So I'm very grateful to have our general counsel for FPMA, Mr. Jason Wynn, with us. We're going to go ahead and share screens, and he's going to define really what you need within your first year residency. Like, holy cow, like I said, you're drinking from a fire hose, but meanwhile, life marches on. There are requirements that you need to be able to obtain your state licensure, certain courses, the like. So, Jason, without ado, go ahead.
All right. Excuse me. Let's go. Thank you very much, Dr. Schmidt, for that. Hopefully you can see my screen. Thumbs up if you can. Awesome. Okay. So if you are a student, you are gonna at some point go through that arduous process of applying for residencies and ultimately getting into one. If it is one in Florida, it's a process that you follow, that you will follow the same process when you go to get full licensure. So a great resource and the starting point for most of my legal research is a place called Google. If you go to Google and you type in Florida Board Podiatric Medicine, you can get to the Board of Podiatric Medicine website. Oftentimes, individuals think that the Florida Podiatric Medical Association can give them a license. That is not true. It is only the Florida Board of Podiatric Medicine. They have delegated legislative authority through the legislature to issue licenses for podiatric physicians, for x-ray techs, and for podiatric residents. So you ultimately get to their website. It is a wealth of knowledge. Here you can get to all kinds of information, including their next meeting. They're going to have a meeting, a public meeting this coming Friday, 9 a.m. You can join their meeting by Teams. You go right over there to the meetings page, click on it, and you can go right to their meeting link. You can read about the agenda and the public book. I'm going to show you that in a moment. But if you go back and you're suggesting that you want to come to Florida to join a residency, it's a two-step process. One step is on your individual side. The other step is from the residency program itself. So these are the types of license I explained about earlier: the podiatric physician license, certified podiatric x-ray assistant, podiatric resident. So if you're coming to Florida for a residency, you'll want to click here for podiatric resident. You'll click on the requirements, and this will tell you exactly what you need to have in order to come to Florida and join that residency program anywhere in the state. So the first step is the completed application for the podiatric residency application. It's a fee and a licensure exam fee. You pay both of those. You'll see those here in a minute. Then the board will receive separately from you, from the podiatric resident director, a hospital report. And this is it. And what they do, the hospital will go in, the residency, and they will enter in any information about the supervising physicians, who the new residents coming in will be, what residents there that are continuing, and then any residents that have completed their residency. This will be received directly to the board. Once the board receives this part from the residency and your application, which must be complete, they will issue you a license. That license is a podiatric residency license. Now, they will issue it to you barring any other issues. For instance, if you had any issues, as you see below here, health history questions that you answer negatively or have explanations for answers that you gave, if you've had previous discipline or you were maybe removed from a residency for one reason or another, any of those, or you have a prior criminal history, Instead of the department receiving your application and receiving the residency report and issuing you a license, the board will meet to discuss your application. They may require you to come before the board and explain what your health, discipline, or criminal history issues were and why you would be fit to receive a license and treat citizens in the state of Florida. Ultimately, the Board of Podiatric Medicine has one mission, and that is to protect the citizens of Florida. So they do that through licensing and discipline of licensees. Once you have submitted that application and you've received your license, you'll see here that during your residency, you'll be eligible to take part 3 of the examination. Once that is done, the process of it is all the applications are submitted, all of the information is received, and then they will issue you a license or have you come before the board to answer any questions. Here, there's no fee for a podiatric resident license. And then here are the statutes and rules. What I'm going to do now is take you to the actual statute for podiatric residency. And this is the Florida statute. When I talked earlier, we talked about the applications by the Board of Podiatric Medicine. They have delegated legislative authority to write rules and write applications that you as an applicant must fill out. But they don't have full legislative authority. That is held by the legislature. So you have in your Practice Act, which is found in Chapter 461 in Florida, is the Podiatric Medicine Practice Act. It covers all things podiatric medicine related, including licensure of individual podiatric physicians, residencies, residency physicians, podiatric residencies, and the actual podiatric resident physicians that go into those residencies. So this statute speaks to the residency programs in the state of Florida. You will see under C, every resident shall register with the board through submission of forms provided by the board. Those are the applications that we just talked about. And then under F, and this may be something that, and it's something that Dr. Schmidt and I were talking about earlier. It's not something that we need to flesh out here or discuss, but this is under F, it gives you the ability within the residency and under the direction of the residency directors for the prescribing of the medicinal drugs under the 461 statute. So that's what you will do to get a license to be a podiatric resident in Florida. Once you have it, you maintain it by staying current with your residency director. If you are going through certain, as Dr. Ister, and I apologize if I butchered that, said earlier, the vascular surgery portion, and let's say you miss 50% of it, you may be held out of moving on to the next portion of the residency program. That will negatively impact you and will be told to the board, who will ultimately give you your full license, or it will be reported to all other states so that when you go to another state to try to get a license, they will learn about it. Once you have completed the residency in the state of Florida, and I know they're more than 1 year, but in the state of Florida, once you have completed the residency of at least a year, then you can apply for your full license. So let's look at the licensing requirements post podiatric residency. The requirements are found here. You have to have completed one of the following clinical experiences, and that is 1 year of residency or 10 years of continuous active practice, but that's for another subject because you guys are very new at this. So you'll have the year of residency. You'll then be able to apply once you complete the 2 or 3 years of residency program for your full licensure, as long as during that residency you've taken part 3 and successfully passed.
And fun fact for students, this differs per state. So brace yourself. Like, for example, I went to Kent State. And, my colleagues who were going to residency in Ohio, they had to take part 3 before they started the residency program. So there are gratefully resources at your fingertips, as well as really smart people like Mr. Wynn, as well as communication from your residency programs to assist with this process.
Yeah, and that I should have made mention of that. I am a licensed attorney in one state and one state only. That is the great state of Florida. However, I would suggest that if you're going to go look at a residency in Texas or Ohio, all of the information that I'm showing you from our board website at the Board of Podiatric Medicine under the Department of Health, you'll be able to locate in Ohio or California or Texas. And if you ever have questions about reading something, feel free to send it to me, send it to Karen, send it to Dr. Schmidt. They'll get it to me, and I'll be happy to read it and give you my thoughts. But they would just be a friendly opinion, not a legal opinion, because I'm only licensed in Florida. So, and that's a good thing to think about also, because you may do a residency in Florida, or you may have gone to school in Florida and now you're going to go do a residency in Ohio, but one day you want to come back to Florida. So anything you do in any state is going to be reportable to any other state that you eventually want to go to. So be careful and make sure that anytime there's any issue with any sort of deficiency in a residency program, that you address it, because it can have long-term effects when you go to apply for licensure in other states. And if you do ever find yourself licensed in multiple states, understand that anything that happens in one state, regardless of it not occurring in the other 3 states you're licensed, those states can take action against your license just as if the incident occurred in those other states. So if you have multiple licenses, great. Just understand the impact it will have. The other issue, I'll show you from the Board of Podiatric Medicine, their meeting that they're going to have this Friday. Fiddlesticks. Let's see if I can get that to drop down some.
And part of mentioning the board's meetings is that within your first year of licensure, you need to attend a board meeting where there's discipline present, correct?
Yeah, so once you become fully licensed as a podiatric physician, then you're going to have these continuing education requirements. And if we look here at the podiatric physician license, so if you ultimately get licensed in Florida, past residency, and now you have a full-fledged license, they issue it to you. During that, once they issue it to you, it's valid from that point until the biennium ends. In the state of Florida, every license runs on a 2-year cycle. So it'll end March 31st, it'll end March 31st and the new licensure begins on April 1st, or February 28th and the new licensure begins on March 1st. Every 2-year cycle, you need all of the continuing education requirements. So if we look at the renewals, so you get your license initially without having to take any continuing education requirements. But once you get it, that first time you go to renew, which would be, let's say, 18 months later, if you got it 6 months into the biennium, then you have 18 months to complete all of these courses, which one of them would be attending a Board of Podiatric Medicine meeting. where you would hear them discuss cases. You would hear them hand out discipline to licensees that have violated the Practice Act. You would see them approve licenses, and you would hear them talk about potential changes or modifications to any of the rules. That all occurs at quarterly board meetings of the Board of Podiatric Medicine. They're all public. You have a right to be there. You have a right to speak at any time. And so that's something that in the state of Florida, we abide by what's called the Sunshine Law. So everything is open to the public, and the public is welcome to participate. So you'll need that one day, of course, and then you have to take the 2 hours of safe and effective prescribing. That's also a part of the new DEA MATE requirement that you'll learn about once you get your DEA license. You'll have to take a 1 hour course on human trafficking, because the Florida legislature about 3 years ago believed that healthcare workers are on the front line of or can be on the front line of helping address the human trafficking issues in the state of Florida. So there's a 1 hour course you take on that. There's a 2 hour course on prevention of medical errors, and then you take a 1 hour course on HIV/AIDS. After you take those courses and that one day of the board meeting, you are finished for that biennium. Then the next biennium, so year 2 through 4 of being a podiatric physician, you will need to complete a total of 40 hours. And they are all listed here with the general hours, the medical errors, laws and rules. And that's when, as a member of the FPMA, you come to one event in January, one event in the summer, and you get all your hours taken care of. And they're all reported.
And I think one way that FPMA tries to assist is, we're likely having another Florida board meeting every year at SAM. So by coming to the meeting, you step out from a lecture, you go to a board meeting as a resident, and, you check that box. Human trafficking, we have it on our website at a discounted price. So, as far as member benefits, I think that it's a really easy in. But Jason, I mean, is that kind of along the lines of what you're getting at with Sam?
Absolutely. Yes. And then that's pretty much it. You've gone through residency, you've gotten a license, now you're practicing, you're good to go. Now you're coming to SAM and you're getting your updates through the FPMA. The board meets, like I said, every quarter. They're changing the rules. When they go to notice rule changes, the FPMA has a voice at those meetings. We voice any concerns from our members at those meetings. We also have a voice at the legislature during the legislative session to make sure that your Practice Act, or the Practice Act for podiatric physicians in the state of Florida, is not diminished. And there's no negative impacts from outside parties. Those are all things the FPMA does in Tallahassee that you as a student or a resident may never even have thought of. But what the legislators do for 60 days can greatly impact what you as a podiatric physician can do. And in the state of Florida, we have a wonderful Podiatric Physician Practice Act. It's very podiatric physician friendly. We always fight to maintain that. And so that's through the efforts of the FPMA and the advocacy that we do here in Tallahassee.
Perfect.
And that's what I would say. That would be it.
Thank you. I appreciate you, Jason. Thank you for your time this evening.
Absolutely. Happy to be here.
Awesome. Great. And he is readily available for all questions. If you guys have issues regarding contracts or anybody that he can connect you with, he's more than happy. Nearly at every end of his presentations, he provides his email and cell phone. So be prepared, Jason. All right. If we can flip back to our PowerPoint. Oh, and there it is in.
Oh, sorry. Yeah. Let me. stop sharing. Sorry.
Before we get to questions, I do want to hit a couple other things that FPMA can do. You guys, as students, you're dipping your toe in. We respect the fact that you're learning a lot. You're here to grow, you're here to learn, but there are ripple effects to our profession, and we're here to protect it. I like to think that we're kind of special ops as far as what we do. We are very unique as a specialty, and truly, our mission within FPMA is to provide the best care that we can within our specialty, and that we are the providers best fitted for lower extremity issues. Moving along with our PowerPoint, these are just resources. If you guys are unaware, you guys are on information overload. I say it all the time. I have kids in elementary school that they're expected to know these things, but sometimes there's just too much stuff to know. So, here it is at your fingertips. If we can move forward, the next slide. First and foremost, you've heard about SAM. If you haven't been, it's a free member benefit. Registration deadline is coming up on the 18th. For young practitioners, we have our annual poster competition, the case presentations, as well as our student quiz bowl, which has been a blast. These are all happening more towards the end of the week as far as the actual conference. So if people are there early and can hang up a poster for you, I'd recommend doing it. Poster and case presentation deadlines, I believe, are January 2nd. So we have a little bit extra time after registration deadline ends. We have the next slide, please. Additionally, you guys might not know it, but if you're actually in practice, we have seats per every component within our state of Florida. Just like counties, our FPMA is broken up into certain locations, kind of chunked out throughout the state. And we have a room for a seat for every young practitioner within that component to come to our quarterly executive board meetings. This is where really the lifeblood of our association is, between different committees as well as reports from components. Also, we have legislative affairs. Mr. Wynn is one of our lobbyists. That makes up 3 that kind of go around with politicians. Every other year, we do something on a political front. This fall, we just followed our Meet the Candidates Forum, where we had about 25 legislators come to our body. We made them sit there and watch a video on what we do as podiatric foot and ankle surgeons to educate them on what we do and laws and things that affect us, insurances, the like. They need to be educated on a grassroots levels of what we see every day in our office. This is really, really important for your future. I can't preach this enough. We are your backbone. We are your support. And so getting involved politically is very, very important, even though all of us hate politics. Okay. So we do also, on the off years, we were planning on going up to Tallahassee this year. We have an actual space within the common ground. So we'll be bringing x-ray, ultrasound, educating people within the halls of what we do, as well as meetings throughout our political realm. Emerging Leader Program is thrown through APMA. I think we brought 6 young practitioners up to Chicago this fall. It's a leadership opportunity for people within our state components, as well as our state-sponsored young practitioners to go up. I went way back when, and people were literally like, here's how you open a practice. And I paid 10 grand for this. Here you go. Versus opportunities throughout billing, coding, brainstorming sessions. So this is all readily available online if you want to look at this for a resource. And students are welcome to join in this opportunities too. FPMA as well as APMA have career centers. It isn't like it is back in the day, like necessarily word of mouth for opportunities for jobs. These are a lot of lifeblood opportunities for job postings. So you might be curious now on things that are happening throughout our nation and state where people post opportunities for jobs. I will say I've known plenty of friends of mine who have had interviews at SAM. It is a very common place for people to gather and kind of have an opportunity for an interview. So keep that in mind as well. Online resources, again, everything's at your fingertips between billing, coding. I hope you guys are into APMA's Red RC. We had something a little bit different way back when, but talking about boards prep, if you've never seen this, Hannah, even you, look into it. It really is a brief synopsis. It's our experts within our field covering topics, whether it's procedure or, condition-based. So it's a really good opportunity to look through those videos, look through those education materials. through the APMA site. They do have a young practitioner site where all of these things are listed. So just to keep a pulse on these opportunities in the future, like I said, this is a running YP seminar series. This is more geared towards students, and so appreciate you guys joining us despite a busy a week of exams. The next one coming up is just prior to SAM. This is a coverage of our ABFAS board certification process. It can be overwhelming when reading it on paper, so this is a really great dive into how to become board certified through ABFAS. Again, in April, we'll have another one in regards to fellowships led by a fellowship director, why fellowships are important, what it involves, what's the interview process like, what to anticipate throughout that opportunity. And finally, in June, we do have the cost of doing business. This is specific for young practitioner billing and coding. It is numbers based, so it's like why this matters, how, if you're in private practice, this affects you, strategies, things to really kind of get you past that learning curve of billing and coding. And I would say that was one of my downsides in residency is I was very proficient coming out in skills, but as far as practice management and all that, there's a big learning curve. So we're trying to get you one step ahead. I know it's information overload. You guys are supposed to know everything, but you just taking the time, putting us in the background, we certainly appreciate it. At this point in time, I would like to open it up to a couple of questions. Dr. Rogers did ask if, when you're looking for an externship, is it necessarily important on somewhere that you want to live and practice upon graduation? Is it more so about the opportunity instead? So I'll open that up to maybe Dr. Ortiz and Hannah. I know you covered it a little bit.
Yeah, I think that's a great question. Generally, my thought process is you want to train where where there's the greatest scope of practice is what I usually tell the students and the residents is generally you want to if you want to stay in a specific area, it is helpful because there is some networking possibilities. You get to meet some of the local doctors. Often, when you're in the hospital, you get to meet some of the hospitalists, and when you get out, it's a little easier because you've already established yourself, and then you will have a little bit of a name for yourself. But generally, I think the scope of practice is the most important. You don't want to go to a state where there's a limited scope of practice, because God forbid you go practice somewhere where the scope of practice is larger and you won't be able to do the things that the scope of practice permits in that state. I sit on the board of directors and the med exec committee for my surgery center, and also I have to review all the applications that come in for the hospital, and often we'll get applications or privilege requests for privileges that a resident hasn't had. Someone's just out of residency and all of a sudden they're asking for ankle joint replacement privileges or ankle fracture privileges, and their residency logs only reflect maybe one or two, and realistically you can't, from a medical legal standpoint, you can't grant those privileges without having appropriate documentation to reflect that there's enough experience. So I think it has to do more with having the ability to practice or train in a state that has a full large scope of practice, so you can be exposed to everything. And then when you get out, those residency logs are really what are going to be looked at when you apply for hospital privileges.
To kind of piggyback off of what he said, one of my favorite lines that I was told last year by one of my attendings, Dr. Cavins, he said, you only have the chance to shop on someone else's credit card for 3 years, meaning you only have the cases that are presented to you that you get to do anything and everything on. And if something goes wrong, it's not your problem to deal with. So it's widely known that there are some residency programs that aren't as good as others. And if there are programs that aren't as good as others in the region you want to practice in, you should definitely choose to go outside of that region to get the absolute best training that you can possibly get, so that you do feel comfortable when you move back to wherever you want to be. For example, I want to move back to Louisiana, but I don't feel like the programs there are comparable to where I am now. So that played a big part in me choosing where I wanted to end up. Is just the experience that you get at certain programs is unmatched, and you just have got to choose a place that will give you anything and everything and incredibly high numbers, so you have that confidence when you get out.
All right, we're opening up to questions. You guys have a real live resident as well as a residency director in front of you. Don't be shy. Do you have any other questions? Maybe something we haven't covered? And honestly, opening it up. Oh, Jeff, I see a hand raised. Thank you. Hey, Jeff.
Thank you so much. Good evening, Dr. Schmidt, and thank you to the panel for covering those different topics tonight. My name is Jeff. I am from Orlando, Florida. Went to UCF, but I'm currently at Kent State, KSU CPM, fourth year, and I have an externship coming up with East Orlando next month. So I have two questions, one for Dr. Istri and one for Dr. Ortiz. My first question is, what are the top 3 qualities the residents are looking for in externs when they're externing for that month? And for Dr. Ortiz, January is a special month because we have boards and also interviews. And for externships during that month, what do you think we should do as externs to get the most out of it and make a good first impression when we have to be away for a few days?
I could start with that one. So 3 qualities I like to look for in somebody. I like someone who's teachable. I like someone who is personable and normal, which it's weird saying that, and I never understood it as a student, but you'll understand it next year as a resident. And I like someone who's hardworking, who's always willing to come to the extra case, who wants to go to the ED with the intern to see whatever case is coming or whatever rolled into the ED today. Like we got bilateral calc fractures today. Our student was there. She was excited. She was helping put the splints on. She was all about it. That's the kind of stuff you like to see in students, someone who's eager and willing to learn and just open and personable.
Yeah, I'll piggyback on what Dr. Esther said. I think that's huge. When I see a student come in and they're willing to learn, they're coming in the operating room, they're helping the residents get their gloves, they're helping prep the operating room. They're taking, the time to go and help prepare the rooms for the morning rounds. Those are the things that my residents love to see. But we also notice that as an attending. I always tell students that the residents aren't gonna give you the residency, but they'll make sure you don't get it. Generally when we sit and review applications, inevitably every year there's like 2 or 3 students where the residents say, you know what, I just can't work with that person. And it's kind of what we were talking about earlier. You want someone who's willing to learn, personable. But it's really important. You're going to be working with a group of other people. Your attendings, your directors. They're there and they want to teach you. Most of them have busy practices. They want to be able to teach and they want to be able to educate and share their experience. They don't want to deal with resident drama. They don't want to deal with who's not getting along with the other ones. So generally, when we're looking at students and residents, we want someone who's going to fit into the fold and get along with everyone else. Now, as far as your question about externing in January, it's everyone recognizes that that's a difficult time. You have your residency interviews. You've got the part 2 of the boards, and it's okay. We understand that it's accepted. Just the time that you're there, just make the best of it, put that extra effort in, sometimes the students will come in on the weekends, to kind of make up for any time lost. But it's okay. We know that you have these other commitments and generally, we don't have any issue with it. And I can't imagine any other program would have an issue with you taking the time off during that month. It's a tough month. Everyone knows that. But when you're there, just make the best of it.
I think another point that has maybe been said, but maybe overshadowed is the fact that it's very normal to be nervous. Students are in a high pressure environment. You think you're going to be asked every, like, what, pull a thread out, like, what, oh, suture is this? I would say it's very normal to mess up, but what residency programs, what directors, what everyone's looking for is just to know you. So, take a deep breath. If you don't know the answer, it's funny, it's fine. You move on and you learn. So I think that, whether it's residency, whether it's, being and attending, it's a learning process. It's meant to be collaborative, and I'd say that our best residents are team players. So for you going in and saying, man, next year's it's just a tough month, but it's what I was given. It's really just about making the best opportunity, not being showy and showboating per se, just being a team player, I think is what, really summarizes it. But going in nervous, it's understandable, but I think most places are used to students coming through and seeing that the first couple of days. And when you learn the lay of the land, you'll be more comfortable. Just like Dr. Ortiz was saying, experience is key, and it's kind of learned, unfortunately. So, but it is an amazing opportunity, really, for you know. Everything book wise to kind of jump off the page in front of you. I think that that's one really exciting thing about residency is the fact that everything that was textbook is a decision that you then have to make with a heartbeat. So it's pretty neat. I do see a hand raised from Gage Griffin. If you'd like to unmute and go for it.
Yeah, hi, my name's Gage. I'm class of 2025 Shoal. I had a question regarding interviews, specifically with kind of the schedules coming out. How many interviews in a day do you feel are too many? I know several people kind of are experiencing this where a lot of their interviews all line up on the same day. And I just want to make sure that I'm getting the most out of each opportunity without, for lack of better words, like burning myself out or not putting out a good light because I'm trying to do too many in a row. Do you have any suggestions to that? Because kind of the scheduling is what it is. So with that being said, I'd take any suggestions that anybody can offer.
So I can kind of speak to this
Yeah.
considering I just did interviews like 2 years ago. I only did East Coast programs. So as you know, it's split into East Coast and West Coast. You only have 3 days per region. I think I ended up interviewing at 6 of the 7 places I externed at. I think I did 4 or 5 interviews one day and then 1 on the Saturday, and it really wasn't awful. They're pretty quick. You kind of get like an adrenaline rush. You don't really find yourself crashing, and I'm kind of like a morning person, so I put mine almost back to back. I had like a 20-minute gap in between each of them, if the scheduling worked out that way. And I didn't feel like it was overwhelming, really. It goes by so quickly, like your heart's racing the whole time and you feel like you're gonna throw up. And the next thing you know, you're walking out the room and laughing with the person who's about to go in, like, oh my God, I can't believe I did that, So I don't think 4 in a day is even too much. Just whatever you can get scheduled because they don't give us a lot of time to do the interviews and we just have to work with what we got, and same to you guys.
Yeah, I don't think there's a set number. I think you want to interview with the programs that you are targeting, the programs you really want to be at. Obviously try to schedule those at times when you kind of know your own body. You kind of, some people are really slow in the morning and kind of pick up around midday, and so just kind of schedule them around the times that you think that you're generally the most with it. But it's a nervous time, regardless. Some students like to get a couple interviews under their belt, kind of almost like a practice interview with programs that they may not be super targeting, and then the ones that they really want, kind of schedule them later in the day once you've had a little bit of practice and you've kind of warmed up a little bit. But I don't think there's a set number. I think you just kind of generally you want to interview with every program that you're interested in, and obviously put your best foot forward, go in, be comfortable. Sometimes the best interviews are the students that come in and just kind of joke around. I remember I had a student years ago. He ended up being one of our residents, and we joked around with him. He had this like really funny big a mustache on his clerkship application. And we joked around with him. I said, you know, the only way you're getting this residency is if you have that mustache on the day of interviews. And he walked in with this big ass mustache, and we all laughed, you know, and it was just, it made everything so easy and you know, but you know, just be yourself, you know, have fun with it. You know, it'll be over before you know it.
Thank you.
Thanks for the question. Any others out there? Okay. Well, thank you all for your time. Before we close, I would like to award our randomly selected gift card winner, which is Jacob Clem. Jacob, if you don't mind dropping your email into our little text box, I'd appreciate it so we can get you off a $50 gift card. Congratulations. But yeah, thank you all for your time. Please pencil in our opportunities in the future as far as these lectures go. It's really exciting. I mean, it's condensed, it's crazy. It's kind of like a quick job interview. And then, you know, really, as Dr. Ortiz says, you know, decade or two out at this point, you still reference things you learned then and how you grow from it. So welcome to the club. We're excited for you guys to kind of get some legs and experience. And, you know, I think that one thing I really appreciate about podiatry amongst every and near every specialty that you will work with, because we work with pretty much everybody, is the fact that podiatrists are pretty great. Like, we're very approachable, very caring, you know, care-centric, skilled. I'm very proud of what you guys are all jumping into, because it's a pretty awesome profession. So certainly reach out if you have any questions. Thank you again for your time this evening.
Thank you, Dr. Schmidt. Have a great night.
Perfect. We'll see you guys
Thank
at
you. Thanks for everyone who joined.
Yep, bye everyone.